Cancer can destroy more than somebody's body inside. It can hurt their enthusiasm for life as they see physical changes, things such as fatigue, weight loss or gain, vomiting, and probably the most recognized sign of cancer, loss of hair. A cancer survivor himself and hairstylist from Connecticut, Hector Cruz, is now fighting for other cancer patients when it comes to their outlook on life and their appearance. Renee Cullon is his coworker, client, and friend. She just fought breast cancer and joins him to talk about making women feel beautiful. Now, Hector, I know hair loss, it probably is not very painful, but it can be very traumatizing to someone going through cancer. What gave you this idea?
When I was going through cancer myself, I befriended somebody. She was teaching me how to knit, and I grabbed her wig one day and just kind of like fixed it up for her, but unfortunately I wasn't able to give it to her. She had passed away, from what I understand. And so I was introduced to Look Good Feel Better. I donated the wig. Once I felt better and got healthy, I started becoming a volunteer with them.
Renee, talk about what it's like to go through that battle, through that cancer battle, and what it feels like to go through all these different emotions.
It's a roller coaster of emotions, and you just don't know how to act, and you have so much going on all at once that you get so overwhelmed and you can't retain information a lot of times. So it's great to have a friend who you've been with through his journey in surviving cancer and bounce off questions with him. And also my sister is a breast cancer survivor too. She lost both her breasts at 40. So I had her to ask questions and get feedback from her.
Talk about how Hector was able to help you kind of fight through this battle.
He kind of made me acknowledge it. I was in denial, and I didn't want to bother anybody, so I wanted to just do everything myself, and he made me realize that I couldn't, that I needed somebody to support me other than my husband, who was great. But you know, when he was working, he took over and went with me for visits.
They deny it in the beginning. It's like, it's not me, until the chemo starts to kick in. That's when they start realizing, okay, I got to fight for my life now, and everything changes after that. What
are some tips that you can give to women out there that are going through cancer, or even not just women, men too, but what are some tips you give them?
I think the biggest one is that they should tell their children. They don't need to know, but that mommy and daddy is going through something, and make like a shaving party. A lot of the times when you're going through chemo, you lose your hair and your skin turns a little bit yellow or ashy, and if your child is between the age between, let's say, 7 and under, they don't understand what's going on. Sometimes they don't recognize the mother or the father, and sometimes the rejection of your child, on top of knowing that you're fighting for your life, it could be a lot worse than the doctor giving you your diagnosis.
Do you find that a lot where women, when their own children don't recognize them, they fall apart? A
lot of the time, yes, but a lot of time people will tell their children, but when women come to see me for their wigs and everything, I kind of hint towards that area, and I try to do like a shaving party. I'll go to their house, or even at the hospital, it doesn't matter, wherever I need to go, I'll go to help them do this for them.
And you've changed women's lives and their outlook on their lives because simply through this. What's some of the reaction women have given you when? Well,
I just got the best review. Her first name is Michelle. She came in, she had a hard time with the wig. She purchased the wig like 2 months prior, and she just kept like holding out and holding out. She finally came to the salon. I cut her hair into a mohawk, then I made her look like Don King and everything. And she just changed from seeing what I did for her, kind of like changed me as well, you know, so it's kind of.
And you kind of just slowly got into this, but now it's really becoming your life.
It's more like a full-time job now. And it's all volunteer also. I don't charge them at all. What I do is I go through their health insurance. They come to me with a cranial prosthesis prescription, and then I kind of take care of it from there. They call the insurance to find out what their deductible is and everything, and I try to keep everything in that price range.
Okay, and what is the next step? Renee, what would you like to see as the next step for Hector as he starts this new journey? What would you like to see?
I would love to see him get his dream and accomplish his segment of treating the patients that are not acknowledged, because it's such a small percentage of people, because they're so young. They're in the middle range where the young people are acknowledged, the older people are acknowledged, but that middle range is what he's working on.
Through the Look Good, Feel Better program, I met this young lady, Heather Drunnen and I. We're starting a nonprofit called Just Young Enough to try to help young adults between the age of 18 to 35. I realize there's a lot of resources for young 18 and under or 40 and above, but there's not that many in that age bracket when you're graduating from college, out of high school, and all of a sudden you're diagnosed with cancer, or even if you're getting married or just got married or planning to have kids and you're told you have cancer, you feel like your whole world is falling apart. What I would like to do is try to have somebody that's gone through the process and help somebody walk through the process.
And what are some tips that you gave Renee, that you learned yourself? What are other tips that you give to other cancer patients that may even have nothing to do with their hair, but just our tips?
Going into the grocery store, for instance, when I was going through it, I felt like my equilibrium was off because of the fluorescent lights in the grocery stores and all the shapes and the colors of all the cans and all the groceries that are on the shelves. That can affect you. Also in the produce section, you have to be careful. You shouldn't touch the produce. Have somebody wash them for you. Can have them. You shouldn't cut them or wear gloves or just have a barrier.
Why is that?
Because there's sometimes the bacteria or the pesticides. Your immune system is so low that just that little bit can give you a fever, and if you have a fever, the chemo will stop and the cancer will get stronger. Another thing that I just found out is if you have a septic system, you should call the people to come down and put some chemical. I forget the name of the chemical. I just found out like 2 days ago. Basically, you still have the chemo inside you. So when you use the bathroom, it goes into the system and will kill the bacteria that's in the septic system. One easy way is to just throw some yeast down the toilet when you're flushing it, or flush the toilet 2 or 3 times to get it through there. But it's always good to call somebody.
Okay. And what is the future? What do you want to see happen in the future with this dream of yours?
I want my nonprofit to get started. I've been working on it for a while. Paperwork is halfway through, and Heather and I just can't wait. And then after that is to look for a location, hopefully. And I have some resources. Being a hairdresser, I have connections out in California and in New York for some celebrity hairdressers that are willing to donate time and their name and their product to try to have fundraisers and everything. My dream is to have our first fundraiser to be like a masquerade ball from like the 1800s or something like that.
That's great. Beautiful hair. You're making women beautiful just by changing their outlook on life, and I'm sure they appreciate it. Thank you so much for coming on the show and talking to us about this.
Thank you.
Thank you for having us.